Thank you, Jeff, and to all at Blue Cross Blue Shield who have worked tirelessly for employers and employees over the past year. Backed by popular demand this morning, I'm really excited to be joined by the medical leaders of our local health systems. Please assist me in welcoming Dr. Matt Biersack, Interim President and Chief Medical Officer for Mercy Health St. Mary's. Dr. Ronald Grifka, Chief Medical Officer for Metro Health, University of Michigan Health, and Dr. Joshua Koistra, Senior Vice President and Chief Medical Officer for Spectrum Health, West Michigan. You'll find biographies for all of our today's panelists and speakers in the digital program, which was included in your registration confirmation, and I think we'll be dropping that in the chat as well. Speaking of the chat, if you have questions for our panelists, I will be getting them up here live, so please don't be shy and type in your questions there. We're going to start off our discussion with Dr. Matt Biersack. Dr. Biersack, I think the things we're seeing in the news is that while we were coming down, cases, everything was trending in the right direction. They seem to be ticking back up. What's the story with this uptick? Is it the variants? What do our members need to know about what we're seeing in this increase?
Yeah, there's a couple parts to this. So we're definitely seeing an increase in case positivity in the community and the number of cases and an absolute number. We're seeing an increase in predominantly younger people turning positive. And one of the concerns that we have is that this could be presence of a variant. We know that there's been variant detected based on testing done within the state. We know the so-called UK or B117 variant is definitely gained traction and that it spreads more rapidly, and there's some studies that show that it's even more deadly than the sort of native virus that we saw last year. So we're concerned about not only variant presence, but we're also concerned about the fact that we're just seeing more transmission among young people. More schools are sort of back, sports are playing again, and so this presents just an avenue for spread for sure.
Dr. Grifka, talk about how the vaccines work against these variants. Do people need to be concerned? Is the science catching up to this? Where do we stand?
Well, thanks, Andy. That's a great question. We know that the variants or the vaccines were tested against the typical variant that came out of China. But with the variants coming out of the UK, South Africa, and South America, we do see a little difference in how the vaccines respond to them. And the good news is, although they may not be perfect, the results have been quite effective as far as decreasing admissions and keeping people from being significantly ill, requiring admission. So although they may contract a very mild case of COVID, it is very mild, they do not require hospitalization, and they, for the most part, remain quite healthy.
And Dr. Koistra, Dr. Biersack talked a little bit about seeing younger folks contracting the virus, but we've also heard about increases in hospitalization. What demographic are we seeing the hospitalizations occur in?
Yeah, so we're seeing a younger demographic. I think the average age of admission at Spectrum Health, in November and December was somewhere around 65. And over the last couple of weeks, when we've looked at the average age of our inpatients, it's somewhere around 53. So we are seeing a younger population. And I think that's multifactorial, maybe due to the variant, but also due to the effectiveness of vaccinating our older population. And we're seeing great results from that. The only demographic that we're not seeing an increase of positivity or hospitalizations in the state of Michigan right now is in the 70 and above age group. So that's good news.
So that's good news. It shows the vaccinations are working to protect the most vulnerable populations. And one of the things that seems to be maybe the messaging is catching up is what can you do once you get a vaccine? So Dr. Biersack, can I hug my grandma? Can she hug her grandkids? Does it take 2 weeks to be effective? Talk a little bit about what can you do once you get a vaccine, or what the public health message should be.
Great question, and one that's asked frequently. The CDC has the most updated guidance around this, and so that's a great resource to go to. Right. We know now that folks who are vaccinated can gather together indoors. People who are vaccinated can gather with another family that is vaccinated or has kids who are low risk, or others who are low risk. But it's still important to mask indoors when we're around people who are of higher risk. People who are older and unvaccinated, folks that have chronic medical conditions that put them at higher risk for severe disease or hospitalization. And so as again, more learning and what we understand about the protection of vaccine is known, recommend look to the CDC for their up-to-date guidance on this.
And, so we're seeing the benefits of vaccine, but we're also seeing, Dr. Grifka, some hesitancy with people getting vaccines. Where are we seeing that? What do you think are the messages to help overcome that? Is it a lot of, I want to wait and see how this new science works out, or where are we seeing the hesitancy?
Well, part of it is just a general trend in the community, not just West Michigan, but throughout this country and the world, less interest in vaccines, some hesitancy with all vaccines, but whooping cough, polio, et cetera. It's a trend we probably need to do something about because it's a dangerous trend. I suspect most of us have probably never seen a patient with polio because due to vaccines, it's been completely, essentially eliminated from the whole world. But yet we're certainly seeing this hesitancy. I think it's important that we educate the community that the vaccines, although they, from initial trial to being administered, is a very short period of time, shorter than ever, it's not because we cut short the science. It's because we're making the vaccine as we were testing it. So once the approval came in, we had millions of doses ready to be administered, as opposed to start making at that point and then a lag to being able to administer. So the science is good, the vaccines are safe. We really need to educate the community about the importance and safety of the vaccine because that's our mode of exodus out of this pandemic with the vaccine.
Dr. Koister, we were talking before the summit kicked off and some hesitancy, especially in the female population around childbearing age. Can you talk about that issue where the hesitancy is there?
Sure. So there, understandably, young childbearing age females that are either trying to get pregnant or, think of that as a possibility in their future, and some concerns about getting the vaccine. However, the American College of Gynecology and Obstetrics, which is, kind of the leading thought leaders, and then the colleges around immunology and vaccination, have come out very strongly that they feel that the vaccine is safe in that population. And all of the data that we've looked at really shows that women who contract COVID-19 have worse birth outcomes. And so we're strongly encouraging the vaccine for that population.
We've also, Dr. Biersack, maybe the hot button question is also, breaking down on political lines too, in some ways. Even though the virus is, apolitical, we're seeing hesitancy among, folks on the right side. So key messaging is probably going to be helpful there.
The truth is that across the board, we're seeing misinformation about the vaccine. We address questions on a daily basis. Is this, are the Pfizer and Moderna vaccines a live virus? Am I going to get, infection from the vaccine? And so, I think all of us are providing a lot of education to the community to offset some of the misinformation that exists out there for multiple different reasons. And I think that's a big part of some of the hesitancy, right? Is that people don't really understand the aspects around safety. They don't understand the trial data. When we talk about efficacy of one vaccine versus another, it's easy to start pinning number versus number, but the studies were a little bit different too.
Well, yeah, Mayor Duggan in Detroit he said, I don't want the Johnson & Johnson vaccine, but then he walked that back. Maybe Dr. Grifka, can you talk about the efficacy there? Do you have any worries about Johnson & Johnson? Or,
No,
put it in perspective for folks of how effective this really is.
That is a very important point. And if you look at, first of all, the three vaccines that are approved, you cannot contract COVID from them. They don't have any active virus, so you can't get COVID, number one. Number two, the trials were done at different time periods in different populations. And the Johnson & Johnson, just the raw number, if you will, it's a little less effective. Not really true because it was tested later when there were more variants available in populations where the variants were much more common. And when you look at the Johnson & Johnson trial, it's one shot, number one, which is tremendously easier. And number two, although some people did contract COVID, it was very, very minor. They did not require hospitalization or no one died. It's really protected you very safely. It's a great vaccine, as are the Moderna and Pfizer. And certainly, if you can get access to any of the three, they're all very good, very safe, very effective. And again, as I said, this is how we're going to get back to normal living.
So if you can get the message here, if you can get one, get one.
Absolutely.
Let's talk about that, right? Chamber members, I think, the past couple months, the number one issue is where do I get these vaccines for my employees? Dr. Koister, it seems like production is ramping up. We have Grand River Aseptic helping, be the Arsenal of Health, get the J&J vaccine out there. We're opening up kind of to 16 and over pretty soon, coming in April for basically anybody that wants it can get it. Where do we stand with, the supply versus the demand right now? And what do you recommend people do if they want to schedule that vaccine appointment?
Well, as eligibility opens up, certainly supply is still going to be the constraining factor. Our 3 health systems are on calls twice a week with the state of Michigan talking about supply that is available. Unfortunately, the supply that we require to meet our demand still is not there. And I would say our efforts, around the West Michigan Vaccination Clinic, which could potentially vaccine over 20,000 people a day, is limited because of the supply. And our hope is that Pfizer, Moderna, Johnson & Johnson will increase manufacturing efforts. I'm sure they're trying to fire on all cylinders right now. But our hope is that we will see increased supply in the next month or so. But the state of Michigan has told us that it's still going to be constrained for the next few weeks.
And where's the best place to go to schedule one? If I want to educate my employees on where they can go to schedule their vaccination, or at least get in line, maybe.
Yep. So there is a website. I believe it's Vaccinate West Michigan. I don't know, Matt, if you can correct me on that if I'm wrong.
I think if you just Google Vaccinate West Michigan, you'll find it.
Or any of our health systems, and there's a very easy online scheduling tool. You can also try and go to any of the retail pharmacies, which have websites available as well.
I'm getting some questions coming in from our attendees, so I'm going to go to some of those. One question is around the death rates, right? We've seen, at least I'm reading headlines, right? We're seeing 50% increases in death rates. Dr. Biersack, you're next, so I'll throw this to you. What do you make about that? Are we seeing increasing or decreasing death rates? And is the definition of COVID death been modified at all? Is that accurately, or all these deaths being accurately attributed to COVID?
I think understanding the data behind COVID is an incredible logistical issue, and there was a lot of question and apprehension about did the data and did the statistics early on really match what was happening? But the definitions, have not changed. Some of the systems that the state uses, right, in terms of identifying when patients have died based on their certificate and coded data, et cetera, remains intact. I think we can very easily trust, the data that comes to us from the state. Has the rate increased? I'm not aware that the rate has increased in terms of COVID, but we're seeing, I think, an increase in the number of cases, right? We know that there's some early literature that suggests that the variants, particularly the variant that was associated with South Africa and with Brazil, may have a higher mortality rate. They may be more deadly, but there's still quite a bit of evidence that needs to surface around this before we can say definitively that there's a higher mortality.
Gotcha. Another question from the chat here, Dr. Grifka. How often are the nurses and doctors being tested for COVID-19 at hospitals and offices?
Very good question. Now, fortunately, I think for all of our healthcare systems, the vast majority of our staff have been vaccinated. So we're over 70% for all of us, which is tremendous relief for the staff and for their families, and also for the patients also. That said, we're still using very strict criteria for PPE, making sure both the staff and patients are as safe as possible. So I think we haven't tested too many, but if there's any questions whatsoever, we are testing people. And I think one thing we are learning from COVID is if a staff person is ill, stay home, don't come to work, as opposed to being the hero and coming and working anyway. But they are staying home, they are getting tested, and if there's any questions, they're in quarantine until we can confirm that they are safe both for the patients themselves and for their families.
Dr. Koister, another question from the chat. Our healthcare systems are basically going to see most of the West Michigan population here pretty soon. So are health systems integrating those opportunities to screen for other concerns like behavioral health concerns when testing people for COVID-19 or maybe delivering vaccinations?
So concomitantly, we are not at this point in time screening for mental illness or behavioral health concerns. However, we do have strong concerted efforts at all of our primary care offices and at all of our touch points when they enter the health system for care to ask those questions that could indicate that there's underlying issues that we could address and help them with. So although I don't believe that it's occurring at the time of vaccination or testing, at the time that they try to access care, it is occurring frequently. And if I can just expound one thing on what Dr. Grifka said, as far as our team members, you know, we have had many that have been vaccinated, but we've had a fair amount that haven't as well. And so when team members do test positive, we look back and see whether they've been vaccinated or not, because it's kind of our own internal study to see how effective the vaccine is. And since, you know, people have been fully vaccinated in January, we've had 341 of our team members test positive, and only 6 of those had been fully vaccinated. So that's 1.8% of that. So that just shows how highly effective it is to keep, you know, team members in the workforce. And as a Chamber of Commerce member, I'm sure that people would want that for their employees.
Got another question from the chat. It should have occurred to me, so thank you to our attendees. Concerns about AstraZeneca in Europe. Any thoughts on that, Dr. Biersack? Is there concerns there, or what do you make of the AstraZeneca vaccine? Is that something we're going to see here in the United States?
You know, there was some study data that was just released, I believe yesterday, and certainly there's been a lot of news about the AstraZeneca vaccine. Actually, since, you know, its first development, there was some questions around data and safety in the early trials. You know, until it really goes for, until they submit formally to the FDA, we're going to keep our focus on those 3 vaccines that are approved. We know that the supply between Moderna, Pfizer, and Johnson & Johnson would meet the U.S. demands. And so, you know, to be honest, Andy, I'm just not sure that AstraZeneca is going to play a huge role in our vaccine strategy. But I'll look forward to reviewing the data when they submit to the FDA.
Great question, or great answer. Thank you. And so, ping-ponging a little bit back to mental health, Dr. Grifka. One of the things we're hearing and experiencing during the pandemic is, you know, it's leading to more mental health issues for folks in a variety of different ways. Are we seeing that manifest at our hospitals with other, you know, illnesses, or are people presenting in our healthcare systems? Is that manifesting in any specific way that we're seeing locally?
Well, no question. We're seeing it in our healthcare system, we're seeing it in our schools and our families and at work also. The incidence of depression and other mental health disorders has really just exploded recently. And, you know, people have been quarantined for a long time. We haven't done our usual processes, usual life plans. So we're certainly seeing much more mental health disorders, and our primary care physicians are very attuned to that, certainly asking questions every time they do have an interaction with one of our patients. But we do need to bear that in mind, and as we get come off some of the layers of the onion, so to speak, hopefully that will get better. But we do have a lot of mental health issues, and people need to get back to living. And all this quarantining has really complicated that and is magnified the behavioral health issues we've seen to this point.
Yeah, and just encourage all of our chamber members to take advantage of the employee assistance programs that many of them have. You know, let's take away the stigma on some of those mental health issues if we can, and seek the treatment to address it. Otherwise, it can lead to other significant issues. Looking back to the questions we're getting in the chat, Dr. Koistra, talking about vaccinations again, what's the timeline towards the herd immunity? Probably one of the questions you get a lot is, when's the herd getting immunized? Easy for me to say.
Sure. So we look at kind of what we call the R0, which is the infectivity of the virus. And if you look at the native virus, we anticipated that we would need about 70% of the population to have the vaccination or to have had COVID prior. To instill innate immunity. And if you look at the B117 variant, we think that we'll probably need about 90% of the population. So we're a ways away from herd immunity. That said, I think the strategy around vaccinating our most vulnerable populations, so our elderly, people with comorbidities, really will lead to reduced hospitalizations because we know they're the most at risk. And that is, a very significant impact to the community rather than, younger populations that may do much better with the virus.
So we can get the vaccines at Walmart, or Meijer, we can get them at CVS, we can get them at Walgreens. Do you anticipate these mass vaccination clinics continuing throughout the rest of the year, alongside these other ways to get? How long do you think we'll have to continue the mass vaccination setup in our communities?
Great question. If I were an employer in, let's say, manufacturing, I think my hand would be up first, right, to say when is it going to be our turn? How do we get our folks in? And I think what's important to know for the chamber is that we're all really working closely with the Kent County Health Department because they've been able to recognize where are there disparate areas within the community that need different access, additional access, supply of vaccine. Where are there folks that have been maybe disproportionately affected by COVID or have risk factors for COVID or have poor access to healthcare in general. And so we're trying to coordinate, as Dr. Koister mentioned, as best we can with each other and with the health department to ensure that we're focused on those priorities of the broader community. And so we're really in lockstep with them on this. So I completely understand, the drive and the desire to get everyone as vaccinated as possible. We all want to get shots in arms as quickly as possible too. But we have to do that in a way that I think prioritizes those that are at the highest risk and the most vulnerable.
Dr. Grifka, what would you tell employers in the West Michigan business community? What's the best way they can help, crush the virus right now?
Well, certainly educating your staff that the vaccines are safe, they're effective. It's fairly simple to do. Please sign up to wherever you can get the vaccine with your healthcare system or other capabilities, because it's the way how we are going to get back to living and functioning our businesses as normal. And if you're talking about healthcare disparities, let me add a new perspective. As a pediatric cardiologist, try to get a kid a vaccine. That's not going to go very well because they really haven't even been tested in kids. Now, we're fortunate with most viruses, children are very frequently affected and vectors to transmit it to other age groups. With COVID, for some reason, due to the receptor, what have you, it hasn't been. But again, we need to get kids vaccinated also, as we're seeing now with the outbreaks from sports and other activities, kids back in school. Certainly, one of the things we're going to need for our community is to get these kids educated, and that's the best way to get them in school. Get them in school is we get them vaccinated and get their teachers vaccinated. So certainly how we can encourage our staff and kids and teachers to get vaccinated is very important to get us back to where we need to be.
Building off that, Dr. Koistra, talking about young folks contracting the virus, anything that they can do to improve their immune system, while we're waiting for that, or just the normal things? Are you going to tell me to wash my hands?
I'm going to tell you that it's important for kids to mask. It's important for social distancing. All of the hand hygiene is certainly important. Good sleep habits, good food sources, all of the stuff that you would typically do to stay healthy is what's going to be important.
And just another kudos from the chat to the Kent County Health Department, all the partnership with the West Michigan entities. I mean, I think one of the things that's been awesome about this pandemic is the way we've all collaborated, all the healthcare systems collaborated and joined together. Dr. Biersack, we did this in August of 2020. Is there something that you've really learned about working in the healthcare environment during a pandemic that's like, wow, this is going to be my takeaway for my memoir, like the last sentence in the memoir, or maybe a takeaway of, God forbid we had to do this again, that we learned through this experience?
Do you have like 8 hours that we can?
Well, I'm trying to get the distilled, motivational quote takeaway.
I think we've all learned so much. Back to the point of, we know that this pandemic has had just a sobering impact on the mental health and well-being of all the patients we serve, the colleagues who work in our systems. It's not just even about mental health, it's about how it's impacted sleep habits. It's about substance abuse that's risen. It's about, unintentional weight gain or loss. And so it's really it's had an incredible impact on the people that have been doing this work. On a positive note, it's been incredible to collaborate with these gentlemen, with the health department. I think we're all thinking about the population and the community that we have here in the greater Grand Rapids area, far more probably than we ever did before. We're sorting data by age. We're looking at it by, who are the most vulnerable in what communities, how do we serve them better, how do we work more closely together. So, those are learnings that I hope we carry with us long, long into the future.
Dr. Grifka, you talked about some takeaways at a GVSU event earlier this year. Talk about some of those. What do you see the long-term changes coming out of the pandemic around the healthcare system?
Well, I think, as Dr. Bierzak said, the collegiality of the healthcare systems, and at times we just need to work as a team to help protect the community, number one. Number two, COVID has accelerated a number of technologies, especially telehealth. And we're going to be able to see many patients now through telehealth, which will be more convenient for them being seen where they are as opposed to having to stop their life, come to the office. But still, we'll require some in-office visits to make sure we're providing the best care. So I think the advances we've seen with telehealth has been very important. But still, there's things we learn. I think it's important to see how well the community has embraced hand hygiene, social distancing and masking. I was surprised to see how effective it's been. Even little kids have been very effective. Is it going to be possibly every December and January we wear masks? If you look at influenza, I was looking at the CDC website yesterday, there have been just over 1,800 cases in the whole country. If you look at the average year season for influenza, at this time there's about 38,000 deaths. So the fact that we've just had 1,800 cases is amazing what we've seen with our social distancing, hand hygiene, and masking. So there may be some long-term effects that are very positive for the community, again, because these keeps these people out of the hospital, out of the doctor's offices, and back at work and with their families.
Dr. Koistra, there's a lot to be learned, the technology aspect of it. How has technology supported our organizations, through this pandemic?
From a communication standpoint, it's been incredible. I think the ability to leverage tools like Zoom and Microsoft Teams has allowed us to communicate to our teams at large and be very transparent with information, which was critical to instill trust, especially around issues like PPE and when our first employee had positive testing and all of the fear that our team had around caring for patients with COVID-19. I think the ability to communicate openly, transparently, and frequently really allowed us to deliver care to our community in ways that we wouldn't have been able to do before. So I'm very thankful for that technology around communication.
Just a couple more questions from the chat while we have just a few minutes left. Any opinions on expanding eligibility when all of our most vulnerable haven't received the vaccine yet?
As I mentioned before, I think even with expanded eligibility, we're still going to remain tightly coordinated and focused really on guidance from MDHHS and specifically the Kent County Health Department about how to reach and certain communities and how to prioritize either geographically or by nature of neighborhoods, folks that may have disparate access to care. So I think patience from the larger community as we work through that prioritization in the space of really not any of us having the supply of vaccine that we would want.
Dr. Grifka, building off that a little bit, healthcare disparities at a point during the pandemic, we saw healthcare disparities really manifest, and especially in the beginning part of the pandemic, that kind of leveled off. What are we seeing right now?
You're exactly right. A year ago, the socially vulnerable patients and communities were very disproportionately affected. Last summer and even over Thanksgiving, we did see that even out. But as we get more people vaccinated, and especially the socially vulnerable, we're seeing a little less of that, but certainly it's something we have to be aware of and making sure we continue to provide access to the patients who have a little more difficulties getting to these facilities. I think the one-shot vaccine may be helpful. And again, educating the community that it is just as safe and effective as the others. It just tested a little bit differently in the trials. But it's a great vaccine, it's a safe vaccine, and the more people we can get vaccinated, the better we'll be. We don't want to keep vaccine in the refrigerators trying to get the last 2 or 3 people who are highly risky. But nonetheless, the more shots in arms we get, as the state's going for 50 to 80,000 shots a day, that's a great goal. That's going to get us to herd immunity as quickly as possible.
Yeah, that's a key communication effort to make sure we're getting all those voices out there to reach everyone possible.
Constant communication, education is just going to be part and parcel of this being successful.
Dr. Koistra, maybe to start, I want to get to this question from attendees. Maybe it's better for Dr. Grifka, but I'll go to you. You mentioned flu season, January, February, maybe wearing masks. Will there be a COVID-19 season?
To be determined. I think if there's one thing about this pandemic, it's led me to never put my eggs in one basket. COVID has been so unpredictable from a, peak trough that I haven't figured it out. And so I think time will just have to tell.
And that's a fair answer to that question. I want to thank the doctors Biersack, Grifka, and Koistra for making the time to be with us this morning, for your leadership throughout this pandemic. The business community greatly appreciates it. Thank you for sharing just some great resources for employers to get more information about where they can help educate their employees on where to get the vaccine. We greatly appreciate it. Thank you so much.